Two things you do not want to miss about the ERCP procedure. Let's just begin with a question. Why would you want to listen to a naturopath about a medical procedure? Okay, I'm a naturopath of 30 years. I have been treating a lot of people with gallstones, and actually I've had a lot of my patients going through this procedure. And so from this perspective, allow me to introduce this tool from a different angle than you would hear if you were talking to a doctor. We're talking here about a simple system that allows you to bring a tube down into the digestive system, go into the ducts, the gall ducts, and theoretically pull out a stuck stone from within the ducts. Or it can be used to place a stent, which is like a coil, inside that duct in order to widen it so that the liquids from the bile can, flow out to the digestive system if they're stuck behind a stone. Now, why am I talking about this? Because two things you need to know that could really make a difference if you want a holistic solution rather than a medical intervention, aka surgery. If you're aiming to get to a liver flush, then the ERCP could be a lifesaver or a big pain. Now, it could also be dangerous. So let's talk about lifesaver versus dangerous. If you have a stuck stone in your ducts, and it is a very painful experience usually, it is good to know that someone can actually go inside and just pluck it out. If it works, it just stops the pain. Very nice to have. But if you have that procedure done, and the doctor that does this procedure nicks a small blood vessel in there and doesn't notice, that can become very dangerous. Because then you start bleeding, and if nobody takes a moment to check if you're bleeding, then you could bleed out, and that could be deadly. So make sure if you're ever going through an ERCP to stick around long enough to be sure that you're not suddenly feeling lightheaded and weak and, losing your focus and other signs of blood loss. If you start getting cold, if you start feeling bad, knock on their door and say, I'm not sure I'm feeling well. They'll check you, and if indeed this is the case, and it's a rare case, but not that rare. I've had at least one case of a patient that had that happen to him. That can save your life. Now, another side which could complicate things, still within the good and bad basics, is that if they put in a stent, then that stent means you can't have that liver flush until it's removed, because you're literally having something in the duct blocking the ability of stones to come through. And they enlarge the duct enough for the flow of bile, but if stones come out, they'll get stuck. And in best case, it just gets stuck. Worst case, everything goes boom. So you can't go through a liver flush with a stent inside your ducts, which means if you're going into our ERCP and you already know that you want to go for a liver flush rather than surgery as a solution, make sure to tell the doctor before they start the ERCP to not put a stent. Okay? Now, what happens if you already have a stent inside? Well, it's not the end of the world. We've had such cases, several, as a matter of fact. The solution is very simple. You go back to the doctors and tell them, look, I do not want the surgery. I want you to take out the stent so that I can go through the natural solution. They won't like it, but it is your body, so you have the right to say, please, and get it done. And they do it. At least here in Israel, we've never had a problem with doctors saying, no. You have to have it. There's no sense in that. I mean, it's your body. It's your right, so long as you're not putting yourself in grave danger. And in most cases, taking out the stent a couple of days or a couple of weeks after it's put in is already, post the inflammation relaxing, the fluids all evacuated, everything's calm. And so when you take it out, everything's fine, especially if you start taking vitamins according to your need before you get to that procedure of taking out the stent. Okay? So, yes, this is a lifesaver if it actually can remove the pain